Good evening, everyone. Glad to see at least some of you.
Hi there. Julio, Dr. Raphael
Yes, Rafael Antigua here. Hi, Julio.
Hello,
and
Tanya.
Julio. Yeah, hi.
Hi.
Good evening, everyone. Is Steve on the call yet?
I see he's logged on.
Oh yeah.
Yeah.
Julio Batista, carajo.
Sandra Harris.
No, she have
My
my
goodness.
name. She have my
Beautiful green. Beautiful green.
Julio Batista.
That's a nice
Soy
green.
por el
you have on.
Partido Verde.
Very good.
Mr. Simon, you're running 30 minutes late and we have other meetings.
Simon says.
Yeah, I'm sorry about that. It was some confusion as to between me and the community board office as to when the meeting was supposed to begin. All right,
I thought it was at 7 anyway. I didn't realize it was just 6:30.
yeah, we were gonna I asked my committee members if they wanted to, as long as we're doing Zoom meetings, at least until January, whether they would want us to go continue meeting at 6:30. And 3 or 4 of the members did respond, and they all said 6:30. And I then told the office to change the calendar to 6:30, but it didn't filter down. I am assuming for the benefit of the committee members that you do want the meetings at least until January while we're on Zoom to begin at 6:30, unless I hear otherwise. Jay is here. Betty is here. Tanya's here. Catherine Diaz is here. Sally Fisher is here. OC, did I say OC is the crime minister, and Jay Mazer is here. And we're also joined by Mary Anderson. All right, so I'm going to begin by giving my monthly report on COVID-19 statistics taken from the Health Department website. It shows that in the last 7 days, there's been a substantial transmission rate in our 4 zip codes, which I think the Health Department groups them all together, because in all 4 zip codes, it indicates a transmission rate of about 60 cases per 100,000 population. And since we last met on September 9th, there are 724 additional cases in Washington Heights and Inwood for a total of 24,288. 7 more people have died for a total number of 822 deaths. And about 8,000 more people have gotten their first dose, and about 8,000 more people have got their second doses. So we have about 139,000 people who have gotten 1 dose, and of those, 126,000 are fully vaccinated. But our percentages are still significantly below those for Manhattan as a whole. Our percentages are roughly in the mid 60, between 65 and 69%. For the city as a whole is at 71%, and Manhattan as a whole is at 80%. And so, as you know, last month we voted to call upon the city to open up a full-time vaccination site in Washington. And that was one of the motivating factors, the fact that our residents are not getting vaccinated as at the rate that we would like to see them getting vaccinated. Pauline, I want to talk to you tomorrow because I'm having difficulty getting all of the statistics from the website that I usually get. It may be that the health department is no longer posting the positivity rates and the number of new cases for each zip code for the preceding 7-day period. And I don't see the rank. used to be able to rank each of our 4 zip codes among the 177 within the city. And I know that we're in the middle range in terms of vaccinations, but I don't know where we are in terms of cases. So I would like to talk to you about that tomorrow.
Sure. Steve, do you want me to share my screen and I can go right onto our health department website and then we can sort of look at it together just to see, because there are some changes to our website actually. So I just wanted to highlight that for everyone tonight. So that might just be a good transition if you think that that's helpful.
Yeah, take it away.
Okay, great. So I hope you can see, I just started screen share. So this is typically where you would go on the data tab to find all of our information with regards to percentage of residents vaccinated. And I think this is sort of what you're talking about, right, Steve? That there used to be a ranking system. I think that maybe if you click on table, you'll be able to see sort of where you stand in terms of, you know.
This is in terms of vaccinations, but there was a separate table for positivity rates.
Got it. Yeah, I don't know if we changed that data. Let's see trends and totals maybe. But I wanted to just share though that we have new updated information about who is going into the hospital and who, like mortality rates based on vaccination status, which I think is really helpful for folks to know. And it really does show that people who are vaccinated do far better in terms of indicators. So let me see if I can pull that information up.
And is that information broken down?
Mortality rates based on vaccination status, which I think is really helpful for folks to know.
Is it also broken down by zip code?
I don't believe it's broken down by zip code, no. Sorry, I can't seem to find that right now.
Okay. Well,
But I will, yeah, let's connect tomorrow and I will speak to our data folks about how exactly the data is being presented on our website. And that way you will be able to search better for the information that you're looking for. But yeah, I just wanted to let you guys know that we are showing information about you know, transmission rates and things like that. And then also information about the vaccinated versus unvaccinated, but I seem to have lost that. I apologize. I also wanted to highlight that at the Vaccine Command Center, they actually have information about pop-ups in various locations. So I know that you have that resolution and was sent to the mayor's office in addition to the Department of Health, but I forwarded on also to the Vaccine Command Center because they're in charge of, you know, putting together the vaccine clinics. And there are some vaccine clinics in the Washington Heights and Inwood area, but just note that it changes weekly because it's pop-up or it's a mobile van. But I just wanted to highlight this for everyone on the board so that you can come back here regularly and you can share this information as to where these vans are. So a couple of them are today and tomorrow. Some of them are through the 9th. You know, I just wanted to highlight this because I wasn't sure if this information was getting out to folks because I wasn't aware. And so I would have shared this sooner, obviously, if I had known.
Yeah, I recently discovered just the other day this particular list. And how do you know how often it gets updated?
So it should be updated weekly. So I would come back and just check on it every couple of days. And so if you see like a date where it's ending on the 8th, maybe check again tomorrow to see if they've updated that list. You know, I think it's just helpful for folks to just come back frequently to see where in their area specifically there would be a mobile van, and then also reach out to the Vaccine Command Center. You can email me to see if you could request a van to come back. Usually if they see that there is a high number of folks who haven't been previously vaccinated utilizing the mobile van, they would revisit locations. So I think it's just good for people to know about the location so that you generate those walk-up appointments, and then that'll show that there's a need in that area, and then they're more likely to come back. And then I'm just trying to highlight some other things on my computer. I apologize. So there's now information on our website with regards to vaccine third doses versus booster. I know there's a lot of conversation around what's the difference between a third dose and a booster. So in August, there was recommendation for people who are 12 and older who received either the Pfizer or Moderna vaccine, but are moderately to severely immunocompromised to get a third dose. And this information is clearly laid out here. And why you need it, it's because it's just to build up more of your immunity, and people who are eligible, again, are 12 and older, but who have moderately to severely immunocompromised systems. And so their immune system just needs that extra boost. In terms of a booster shot, this now has only been approved by the FDA for people 18 and older who received the Pfizer vaccine, and it's being recommended for folks 65 years or older. So regardless of underlying health conditions, or if you have an underlying health condition and you're under the age of 65, or if you have, more exposure because of where you work or where you live. And so this is the difference between the two. So the booster shot is only approved for Pfizer. And if you receive the Pfizer vaccine, and you can only get it 6 months after your second dose. Whereas if you need a third dose just to boost your immune system, you can get that 28 days after your second dose of either your Pfizer or Moderna. So I hope this information is helpful, especially for those who are older or who may be immunocompromised. I will link this into the chat, but that's sort of the biggest news of the day. And I just wanted to make sure you all were aware of that. So those are my biggest updates. I'm sorry that I can't find the vaccine versus unvaccinated. Let me just close this a little bit to see if I can move this around. Oh, here it is. I knew I saved a tab for a reason. So here is the rates of folks who their cases and hospitalizations. And so you can clearly see that if you are vaccinated, your cases and your hospitalization is really, much less than those who are unvaccinated. So I think it's just really important for us to share this information to those who might be hesitant about the vaccine. It really clearly shows that vaccines are working and they're safe. So just wanted to share this. I can link this in the chat as well. And I am now happy to take any questions. Thanks.
All right, thank you. When we talk tomorrow, I also want to talk to you about the best way to get the word out about those pop-ups, vans, whatever. I would like to have the community board do like a weekly email blast, or maybe more often than once a week, to get the word out, because I don't think people know for the most part that those vans are around. But again, I think we would prefer to have something that's permanent and full-time, where people know it's there and they can count on it and know where to go. So Sally has a question?
Yeah, just to clarify, whether it's called a booster or third dose, the dosage is the same, correct?
I don't know, but I will definitely find out. I'm assuming so, just based on the data that's available, but let me just double check. I don't want to misspeak.
Great, thank you.
Is that a word? I don't want to give false information. So let me just find out for sure.
Very good. Any other questions? All right, great. Thank you, Pauline, and we'll talk tomorrow. Okay, I don't think Nye is with us. I told her she didn't have to join until 7:30. So why don't we move on to Sandra Harris? No, but she's busy eating. So I
I
don't,
saw you eating and I got jealous, so I went and got some food.
I hope you're doing better than I am. I'm having Kit Kats.
I'm having cheese, so I'm not doing that much better.
Well, that's better.
Okay.
I can go to the,
So I know that tonight we have our doctor, so do you want me to give my brief update that I will also email to you and then have the doctor present?
yeah, the doctor is in. Very good.
The doctor's in the house.
All right, so, yeah, why don't you give your report and then
Sure.
move on to,
Okay. So I'll give her a quick update, and as usual, we'll email it to you for the minutes as well.
very good.
So on our campus testing data, we continue to test for COVID. And as of September 27, we have 1,700 tests were conducted on campus with only 4 positive results. So that's really amazing. And I have no idea who those 4 positives were. As many of you know, we have implemented a policy mandating students, faculty, and staff to be vaccinated. We are currently also in conversations with the city. As many of you know, we're also a polling site, and we're trying to figure out what the city's mandate is in terms of their poll workers as well on site, because our policy is that anyone on campus must be vaccinated.
The polling site is at the Berry.
At Raspberry.
Raspberry Medical Pavilion, which is also, it's also used for early voting.
Yeah. So I believe we're doing about 20 days, 15 or 20 days of early voting. It's coming up.
No, not that many.
Yes.
But
10. 10.
Well, how many? Yeah, Julio, it's only 10? Yeah, okay, yeah, good.
10. Well, we have about 4 Columbia sites, so make that 40 for us. Multiply that.
When 1,700 tests, are those all up here at the medical center, or does that include Morningside Heights?
No, that's our medical center, CUIMC campus.
Okay.
Okay. I have good news. Our Columbia Dental School is getting ready for its new state-of-the-art dental van. We started doing community outreach with Elder Smile at the Jackie Robinson Community Center, and we'll soon, November 12th, I will be sending out invitations. We'll be doing the ribbon cutting for our new dental van. So we're very excited about this, because it's a brand new van that will be going out to senior centers, daycare centers, and we're actually also going to be able to do COVID vaccines as well on the van. So we're looking forward to that. I'm sure that some of you may have received our press release, or the mayor's office press release, that Columbia was awarded the New York City's Pandemic Response Institute. So we, along with CUNY Graduate School of Public Health, will be leading New York City's Pandemic Response Institute. This will require us to work across all 5 boroughs and establish we're calling them hubs, response hub in each of the boroughs. So we will be working with local elected officials, community organizations, and definitely government, because we also need to identify a lot of money. EDC, who is the funding institute, is providing $10 million. And we have to fundraise the rest. So the total cost of the institute is between $50 and $100 million. So I'll be going to the community board for a lot of letters of support for us to get that off the ground. We also, let me see what else we have here. Oh, with our Urban Comprehensive Cancer Center, we just started a scholars program that links Columbia with HBCUs. This will provide scholarships for biomedical research scholars to graduate students of underrepresented schools, minority schools. So we're looking forward to that. We will be introducing and announcing some of the first cohorts of those students that will receive those awards.
Would you,
Sandra,
would you be recruiting some of those students into the medical school, into PNS?
will we, with what? I'm sorry?
Would you be recruiting some of those students from the HBCUs into PNS, into the medical school?
Well, that's on the doctor's side. A lot of, it will not be recruiting them necessarily to come to our medical school, but it's definitely to come to our cancer center and do some of the biomedical research. I mean, historically, with a lot of these initiative, students do get exposed to all the opportunities that we have, and they could very well be applying to Columbia as well. Last October, oh no, we did have our velocity raise, and we raised $1.1 million for the Urban Cancer Center. I'm not sure if some of you participated, but we usually do get a nice representation from community participants. So that's always a nice ride for us to have. And lastly, and there's some other things, but I want to highlight that our Mailman School of Public Health was awarded a grant to start a Reading Colors library. And this is an initiative ran by an organization called Health for Youth. And it provides library books from authors of colors and stories of authors of colors. So we will be housing this library. It will be physically by Barnes and Nobles at Haven Plaza, and will be managed and operated by our office. And the goal is to have story time, to have local students from the community be able to come to the library, to Barnes and Nobles, and to have read-alongs and really conversations with some of these authors. The books are completely free, so students are welcome to take it with them or bring new books as well. And our office and the Mailman School of Public Health will be maintaining the books to make sure that we're always stocked with books of authors of color. So that's it for us. Any questions? It's nice to see everyone. Sarah, I see you.
Is there a question from Mary Anderson?
Mary, yes.
Hi, I don't have a question, but I have a comment.
Yes.
Very excited to hear about the mobile van with elder care, because we've been talking a lot about the need of the seniors to have better dental care or dental care to begin with, which you know a lot of them don't have or aren't able to get. And we actually did have a presentation in our July meeting, and we're also going to be re-inviting her to I forgot her name, Bianca, yeah, we're going to be having her come, asking her to come to our next meeting in November.
Great.
To give us the updates and
We will.
finalize that information. So yeah, committee's excited about
that. Has been a need, and one of the things that we started to do, and actually the van was the Manhattanville housing, and what we're asking also a lot of the senior residents, the coordinators, is to let us know, because they are the voices within the buildings and facilities, to allow the seniors, let them know when we're going to be there and allow them to come down to the main lobby. But we're definitely, with a new van, will be much more on the road and more I was going to say hands-on, but really wheels on, and being stationed across senior housings across the community, both here, Harlem, and in the Bronx.
Might you also be going to the senior centers?
Absolutely, yes.
Okay.
Yes, we're working with Yvonne and Nigel also on some of the senior center facilities that they're rehabbing, and making sure that that's an added service and component that we're offering as well.
Sandra, didn't we also discuss, maybe it was with the hospital and not with you, having some kind of a mobile crisis van to handle mental health?
We have, well, it's probably the hospital, but we already have one in the community. We do.
And it's in operation every day?
It's not every day. I mean, Julio could give more. It's really on call and on emergency basis. But I know that when you look at even in the city's Thrive website, you can reach out for these mobile crisis units. And each borough has one unit that is directly linked with the local precincts and so on.
And I could find out more about I know that Dr. Warren Ain, who has come before this committee in the past, has also mentioned about the mobile crisis van unit. So I could get you further information on that.
But there is one in each borough as part of the city's Thrive initiative.
But that would be in addition to the van
Yes.
that you have.
Mhm.
Okay. Okay. Catherine has a hand up. Catherine, go ahead.
Yeah. Okay, thanks, Steve.
Hi.
Hi, Sandra. I'm really
Hi.
excited to hear about the library. Just wanted to check, when is that project set to launch? And, are there like any collaborations that y'all are going to be seeking? Because I think it's really dope. And the fact that we also have such a rich community of writers and, writer associations and bookshops and whatnot.
Yes, so we're definitely partnering with Word Up, and we have been thinking of how to get this out. And I'm not sure if the community board has been abreast, but the Uptown Games has been moved to the 30th and they're going to do some type of Halloween Uptown Games celebration. So we want to seize that opportunity to also highlight and have the opening for the library in collaboration with a lot of the youth programs and the local schools, and of course with Word Up as well. So we will be sending out invitations for that celebration, but it will most likely be towards the end of October.
Okay, awesome. Thank you.
Yeah.
I'm sorry, what's at the end of October?
It's our Read in Colors Library event.
When the opening.
No, I just sneaked in the Uptown Games. That's not my report. Sorry. Forget I said that. I'm reporting for other organizations, and that's not right.
Okay. The opening ceremony for the library is at the end of October.
Yes.
Okay.
And it will be an outdoor event. So it's a nice it's like a library box, so it's weatherproof. So we're going to make it very catchy and useful for people to access. So
these are fun. We're talking about children's books. Is that correct?
There are children, youth, adults. Yeah.
Oh, so across the board.
All of authors of color. Yeah.
Okay.
Mm-hmm.
All right. So we can't sneak in.
But if you have any books, we also take donations. They have to be in good condition.
All right. I want
or new, ideally.
Okay. Very good. Any other questions? Is that OC?
Yes.
OC?
Yeah, I have my hand up, but yes, Sandra, I actually, if you're looking for books, then let's talk offline because I have tons of them ongoing. So
wonderful.
Okay.
Okay.
My question to you, and I don't know that you can answer that, and if you can't, maybe you can hook me up with somebody. I want to know, I would like to speak to the person or a company that does the raccoon trapping at Bakerfield.
That's contracting?
I'm not sure how it's being done. So, because there is some situation with the cats, there is a cat colony there, and it's a registered colony. And I think that every once in a while they're trapping some cats. And so I would like to have a conversation with them.
Okay, yeah, so I can connect to our facilities team person up there. So I'll send you an email right after this. Mm-hmm.
Great, thank you.
Okay.
Did you say raccoon trapping?
Raccoon trapping.
Okay. All right. Okay, very good. Any other questions? Okay, very good. So we want to turn it over now to Dr. Lantigua, who is Professor of Clinical Medicine and Associate Dean for Community and Service Programs, and is here to talk to us about the medical center's anti-racism initiative. OC, pay attention.
OC, what is your background? Crime what? I want to see it.
He's the crime minister.
Minister. Okay, got it.
It's an Israeli politics, too long to, yeah.
Oh, got it. Prime Minister. Okay.
I believe it applies to the previous.
The prime minister. Yeah, okay.
Right.
Okay, got it.
Netanyahu.
Yes. So Dr. Lantigua is going to give you all an update on his office anti-racism efforts and most importantly at some of the great partnerships and collaborations that we're establishing with our partner universities in the city to advance underrepresented minorities agenda. So, Doctor.
Thank you, Sandra. Thank you, Chair. Good evening. Steve and the committee, in terms of the class of 2025 that started last August of medical students, we did very well. 28% of the students are minority students. 28%. 17 of those are male African Americans, which is very difficult to get African Americans to come to medical school. And we are well above most medical schools nationally. I mean, international, of course, those are the minorities at the medical school. But if you see our peers, I mean, we are well above. We did lost a couple to NYU. As you know, NYU is completely free these days, and we don't match that yet. Although we do have a good finance program, but we are not completely free. We still do some internal loans to some of our students. I mean, that we lost, 2 or 3 students to NYU this year that they were at underrepresented minorities. But we're doing very well. We're in the process of interviewing. I can tell you, I have done so far 9 interviews, and they are the superb applicants. That we will have another good group coming in next year. And that's moving very well. Well, I'm here to talk, like you said, about the anti-racism task force that was set up last year by the dean. It was around 65 faculty members for all 4 schools. We were divided into 6 groups. I had the honor with Dr. R.J. Williams, Dr. Ann Taylor, to co-chair this task force. And we came and presented to you before with the dean. In case that you forgot, there were 6 at the committee set up. One was on faculty recruitment, retention, advancement, and leadership. One was on anti-racism education and curriculum change. Another one on healthcare disparities and solution research. One on clinical care. One on civility and professionalism. And the one that we're going to be talking this evening, which is on community and public service. That I also had the opportunity to share. We continue to meet. Now we do have an executive committee of around 20 members from all 4 schools. And we have included now the student, 4 students, 1 for each school, to represent the student body into this executive committee. We do have meetings every 2 weeks. The task force co-chairs with the dean. We meet every month with all 4 deans, and we meet every 6 weeks with the clinical chair and also with basic science chairs. That it's an ongoing process where we report on progress. Let me tell you that as a group, we have established a monthly conference for the whole faculty. It's a lot going, if you see, at the health science campus, but also the Morningside campus. We had to deal with diversity and anti-racism. About 2 weeks ago, we presented to the whole faculty a lecture that we call it the Art, Science, and Reward of Community Engagement. It was at an hour and a half, was given by 6 of us, where there was about 250 faculty members who attended, and we will discuss the art, science, and reward of community engagement. And this is part of a monthly talk about minorities in medicine and including research, education, and clinical care that's been given to the faculty, students, and fellows at I'm guessing every month. I can tell you that about 2 weeks ago, we began a series of programs with School District 6. I mean, what we're having at Zoom meetings with parents, teachers, and students. We have one last Thursday, on COVID-19. We have one today on COVID-19 and mental health. We're going to have one next Tuesday. They're going to be about on influenza vaccines and COVID vaccines, and giving that one and giving this following title: COVID and influenza vaccines, what you want to know and you're willing to ask. I mean, that would take place, but we already have at a series until the end of the year of the conference set up with the district. They send it the pamphlet and the invitation to all parents and to us, the teachers, and this has been done bilingual with translators. And we have another one on mental health coming in. We have one on cancer prevention. We have one on smoking cessation. And then as the superintendent giving us topic, we will be getting the faculty to produce this talk. We also set up a program. We want this time at the school at George Washington. We have our ADRC. ADRC stands for Alzheimer's Disease Research Center. 10 students from the sophomore class at George Washington were selected, and each of them was paired with a mentor. And this mentor will be following this student until they complete high school. And this is being done by Zoom now, but hopefully we're going to do it at in presence. They are teaching them not only reviewing their classwork, but teaching them physiology, pathology, at showing them at issues of Alzheimer's disease, and at the idea that in the summer they will come and work with us and stay time with us. And 10 students will be selected every season. I mean, and like I said, they will stay with us for 3 years. At the peak, we'll have 30 students. We are also in the final phase to begin in the spring a program that we call 2, 2, and 2. This program is in conjunction with Hostos Community College, the School of General Studies at Columbia University, and Merriman School of Public Health. These students are going to be selected. We're going to start small with 3 students. Hopefully, we're going to go up to 10. They're going to be selected. They will get a full scholarship to go into Hostos. By the time that they get admitted to Hostos and selected, they are going to be assigned a mentor from the School of General Studies at Columbia. 2 years after, they will get the Nancy Michelin scholarship. I mean, that each of them will get $3,500 when they move to the School of General Studies at Columbia, where they also will get a full scholarship. At that time that they move there, they're going to be assigned a mentor from the School of Public Health. And 2 years later, upon graduation with the BS from Columbia Morningside, they will come to the School of Public Health. But in 2 years with a full scholarship, they're going to be getting also a master's degree in epidemiology, or a master in public health with concentration in epidemiology. And we call it 2, 2, and 2 because they spent 2 years in each of these programs. We were also able to secure to appropriation from the congressman $750,000, and soon with the money reach us, we're going to begin a comprehensive mental health programs in the community. And that is going to be done in conjunction with Psychiatric Institute, some of the ACN clinics, and some of the community physicians. We continue also to reach out to our community physicians, and we have with the medical associations set up conference now that even extend now to the Dominican Republic, where we have faculty from here and faculty from there. We select topics, and once a month we are meeting to discuss topics that are pertinent to the community. As I saying, talking, we were able to secure a grant from Pfizer. Through that grant from Pfizer, We are now even looking for a space in the community and looking for 3,000 square feet in the community to establish what we're calling the Columbia Community Center. In there is going to be an area to train taxi cab drivers and community health workers. The idea that we have is that we are going to train them to speak with passengers about common illness, access to care, and they're going to be trained when the passenger goes inside the cab, is going to pop up in a television, a 2-minute segment about an illness, and then the driver will engage the passenger into discussion about that pertinent disease or issues of health insurance, etc. And we hope again to begin, we have the money to begin that program, at very early, and we're posting a position to be interviewed. Through that program also, we were able to get a coordinator to do health education on COVID in the community. And we're going to be interviewing for that position very soon. In there also, we're going to establish a program to get more community persons and more minorities persons to be involved in clinical trials. And this is through a process of education to the community about the importance to be participant in clinical trials, because as you can see again in a paper published this week in the JAMA Neurology by Jennifer Manley and another co-author from Michigan, it's a new drug for Alzheimer's disease that is out there in the market, but that drug was never tested in minorities person. However, they want minorities to use it without knowing what kind of side effect that it will have into them. We continue to do talk on vaccine hesitancy. As you were present, Steve, you know that I gave one recently to the Manhattan Board of President, but we're also doing 1199, we're doing nursing home, and we're doing also at some of the schools to talk to them about the importance of getting vaccinated.
And CBOs, and I want to emphasize this part of the efforts that Dr. Antigua has been leading, because many of our nonprofit providers are facing huge challenges with employees not getting vaccinated. Some have even lost contracts and lost employees and are not able to provide those services. So it's very important that we get to the CBOs and really share this information and do the best we can to make sure that they keep, they have a workforce to provide services in the community.
We're also expanding with the Cancer Center to establish more educational programs in the community about cancer prevention and disease prevention. And they're going to be doing more, and they're also joining us with school programs. But we are going to get an article in Manhattan Times, maybe once a month, about educating the community about cancer prevention and education. That will involve smoking cessation all the way to mammogram, pap smear, colon cancer prevention, etc. But that is also another ongoing activities. And then finally, we expand also the Academy of Community and Public Service. And the Academy is a reward to faculty who work in the community, that they get elevated to the Academy. The Academy started 2 years ago. It was only in the medical school. Now it's on all 4 schools: the School of Public Health, the Dental College, and the School of Nursing. And this year, in March, we elevated 22 faculty members that have shown demonstration to work into this community, to be members of the community. The faculty now is establishing an executive committee to really guide us on discussion of how we can get more involved in community issues. They continue to approach us at the faculty. Next week, we're going to be meeting with White Coat Gag Mallers student, and we're going to be discussing also how they get more involved into community issues beyond the clinics that we have with the medical student, like a Cosmo and the LGTB clinic. But we're looking to see how we get more of the leadership involved with medical students and really getting close to the community. This is, again, a brief summary of some of the activities that are taking place into the community service at Task Force, or the B Anti-Vaccine Task Force. All the others keep moving. I can give you a little bit. We are establishing a professionalism office. We have interviewed now candidates. I mean, and we are going to be selected next week. The person that's going to be the head of the office. The office, of course, I mean, will have full-time staffing. We continue to have discussion on the clinical care. We're meeting with the chief of services every week, and we're looking more and more and more together with the hospital how we can bring all these clinics together, and how we can look to offer access to our community in a more systematic form. I mean, that discussion is also taking place among all us. And the final one is that we're also looking into the recruitment and retention of the faculty. And now we monitor each department, and each department every year give us the status of where they are and who they recruit, I mean, and to where and who interviews them. Most of the department now have a diverse officer at the faculty level: medicine, surgery, OBGYN, pediatrics, orthopedics, GU. They have a diversity officer also that is part now of the leadership of each of those departments.
Thank you, Rafi. Now, it seems as though the anti-racism initiative has been broadly defined to really expand out into the community, not just involve the medical center, but to involve the entire community with the medical center and vice versa, and to increase the services and the commitments made by the medical center in the community. So it seems much broader than what I had initially thought. Now you just your report just now covered so much. It wasn't easy to keep up with all the different things. Do you have notes? Do you have something in writing that you could forward to me?
We can send it to you. Yes, we can. I mean,
we'll put that together, Steve, and send it over. It was just sort of last minute, and trust me, there's more to that. But those are one of the things that that we're doing in the office is really capturing a lot of these initiatives and partnerships. And I would have to say that while we had these partnerships before, I think post-COVID, there has been a greater willingness from the part of community, especially school districts, to collaborate with us in a very strategic and structured way. It may be because we're now in this virtual world that facilitates communication and bringing these workshops to parents and others, but there is definitely, we sense, I would have to say that there is more of a acknowledgement of the need to partner with the university and our researchers and faculty with community.
Yeah, and let me give you a big one. As you know, in medical school, you get promoted from the resident to fellow, from fellow to assistant professor, from assistant professor to associate professor, and then to be a full professor. And it has been historically in three areas that you'll be promoted: as an educator, because you're a good teacher; as a researcher, because you really do good research; or as a clinician, because you are a good doctor. No, we have added now community service as a way to be promoted. And there's a definition now of you could be promoted from assistant professor to associate professor just by doing community service. And this is a very important part now, because now it's 4 legs. It's education, research, clinical service, and community service. And all 4 together are the structure for a person to be promoted inside CUIMC.
So that was education, research, clinical service, and community service. Is that correct?
Correct. Yes.
Well, that's a major change.
It's a major accomplishment. Yes, it is. It is. Yeah.
But what's very interesting, though, is to hear about what you're doing internally within the faculty, as well as what you're doing in the outside community. So please, Rafi, if you could write up these notes. This is a hell of a lot that you just communicated to us, and it was not. I would like to make sure that I have it straight. Now, I got 2 other questions, and then I'll turn it over. You briefly mentioned beginning some mental health programs. I think you said in the spring. Can you give me some more detail about what that would be?
Yes, as you know, we were looking to really pair with the city of New York, with the mayor, to start a very comprehensive mental health program. We put an application with the mayor. I mean, we thought that the money was in the budget, but never make it to the budget. I mean, we wrote a proposal to Congressman Espaillat and to the application committee, thanks to Ross Rommel and Sandra and others. We were able to secure $750,000 to start this program. I mean, the money should be coming in from the congressman. Immediately is here. We're going to establish the program that's going to be done in conjunction with the CBOs and in conjunction with community physicians and the ACM clinics.
All right. Well,
And we'll be coming back, Steve, to the committee once the program is finalized. I think it's the mental health programs. We're also working on increasing community advisory board participation by community members. So we're getting ready to announce some of the new ways we're structuring communities' contribution in these community boards and how we compensate individuals and their respective institutions, because they are bringing, in fact, their expertise to the tables when they are collaborating with the university. So we'll be talking a little bit in future meetings about ambassadors program and our community advisory boards as well.
Yeah.
This mental health program is being referred to as the ambassadors program. Is
No, this is different. No,
it's different. We have
another one.
The CTSA, as you know, the Clinical Translation and Science Award, of which I am the co-chair of the Community Engagement Committee. It was awarded. I mean, at a very large award, which is going to be celebrated this week, because it was just announced. This is at the tune of $34 million. In there, I mean, this is COMC wide, because there are faculty for school. In there, we had developed an ambassador program, of which Community Board 12 is part of that. We are establishing that every time that a person from the community serves in one of these advisory boards, they should be compensated for their time. I mean, it's two things that we are doing. One, to be sure that when they are there, they feel that they are part of the committee, and the science that is discussed, they understand the science, and we're taking them into this. While at the same time, the scientists also take into consideration the expertise that they bring from the outside. And we have two of those now being set up. Today, I was approached by ADRC to do a third one. But I mean, this is the way of the future. The way of the future is that bring them in really to be partner. Do not bring them in just to use them as their name into your grant, but they have to be real partner. And this is a process of education for our faculty to understand this. I mean, let me finish with this. The classical motto, no? We are pressing in as part of this community to have more and more faculty serving outside the institution, to be members of community boards or institutions or a community-based organization, to serve on boards, to do things that's beyond just the grant and the education that we do. While at the same time, hopefully post-COVID, we're going to be doing more or bringing in more community persons like we do with PME, with the idea that, yes, we want to see you inside the buildings where you're not sick. We want to see you, that you share with us when you feel healthy, not when you come to us because you have an illness.
Let me, one more question from me. Back when the Audubon Ballroom project was under discussion in the late 80s, early 90s, Columbia, among the community benefits that Columbia offered was the creation of, I believe, what was called the Malcolm X Scholarship for incoming students at the medical school. Is that scholarship still around? Is that scholarship being used to bring in students of color into the medical school?
we use that scholarship, Steve, and multiple others to put together a full package. Yes, it is. Mhm.
Okay, very good. Okay, Sally, you have a question?
Just a
I
comment.
believe I had my hand up. I believe OC had her hand up first, and then I had my hand up. I'm just saying.
I'll wait.
OC was first though, because I was watching.
Okay, I
So what
couldn't-
side? Because you all are on top of my screen.
okay, it looked as though those hands were, I couldn't see the hands, they were in faint color. Okay, go ahead, OC.
Okay, thank you. Thank you, Dr. Lantigua, for being here and presenting. I'm sure everyone are very happy to hear your updates, and I hope you'll come back in 3-4 months and give us even more updates. Awesome. I have 2 questions. One in regards to, you mentioned that the medical school currently have 17% of the students are African-American. And my question is,
No, I'm sorry. I mentioned that we have 17 mayors who are African American, and 28% of the class is URN. 28% are underrepresented minorities. Out of these 28%, 17 of them are really mayor. They are medical school like ours that have no one. It's very difficult to get male African American to go into medicine. I mean, we are really working hard, to do it. I show now, the work that we have been doing the last 5 years by having classes to these students during the summer, attracting them, bringing them in, calling them, showing them the advantage to come to us. The programs that we offer, not only in science, but also the mentorship that we offer, pairing them with minority persons that they can see people who look like them. And that that this is the program that have been created. And out of Hilda Hutchinson Diversity Office, let me tell you that her staff now, there used to be 3 persons, now it's 8 persons. She got 5 more faculty to help her, to help in the recruitment of underrepresented minorities.
All right, so to be clear on this, 17 of the students are African-American. And
Male.
say what?
African American men.
Males, and we emphasize on males because it is very competitive to get males into medicals, Ivy League medical schools. So it's a big deal. And 28% is underrepresented minority in total.
so
So there are no African-American females. Is that
Yes, more or less the same number. But African American female, they do come to medical school, but having very difficult it is to get African American male into medical school. You see what I mean? Usually you get 2 or 3. We had classes in NYU that had no one. I think that last year NYU had 1 male, African American male into the class. That they are very, very, very hard. You really have to work to get them from the beginning to apply to medical school.
all right, so you're pointing out that a major gain here by being able to recruit or to admit 17 African-American males, and you have an equivalent number of African-American females. Is that correct?
Yeah. Okay, but they use, like I said, recruiting female African Americans. They do apply to medical school. They compete, and we compete with the rest of the country for them. But they do apply.
Okay, OC, back to you.
So I would like to ask my question. So what is that number in relation to other medical schools, in relation to NYU, you just mentioned, Cornell and other medical schools that offer, medical programs?
Twice the numbers that they have. The most that they get to 14-15%, we're at 28%. I feel like I said that we are, from the Ivy League, we have more underrepresented minorities than any other Ivy League school.
Okay. All right. My other question is, do you offer any workshop to high school seniors that thinking about potentially going to college, maybe interest them in the medical field? Do you attract them? Like, do you go in our district and speak to high school seniors and see if there is some, I'm just trying to see if there is a way to get like to attract them into the medical field. And
We
I
do-
wonder, what are you guys doing in that, in our district?
We do a lot of that, and we would like to do more. But it's very difficult to penetrate the curriculum of high school these days. And because most of the work also is virtual, then you have to have the support of the clinic from the central district. And I tell you, like for us to start the program where we selected 10 students from the high school to be mentored, each of our faculty have to go through clearance from downtown. They have to give them the social security number. They have to do FBI clearance for each of them. They have to have that. It's a real pain in the neck to
Yeah.
do these days. I mean, but we want to do
Yeah.
it. We'll do it.
Yeah,
We-
I see.
we
So
are
I'll
We have
I'll
offered
also
to be-
add, each year we run the SPREP program, which is a program that targets high school students, and they spend a whole semester working with us. It's very competitive. We go to all of our local schools, and I'm saddened every year to say that for us to get 1 or 2 students from our local high school is literally like pulling teeth and holding hands with the parents and everyone else. Most of the students that we get are coming from Brooklyn, Queens, and other areas that are much more aggressive in getting their applications in and submitting. And this is a program that we do every year. We're out there talking to people. I mean, we've even done Kaplan programs, SAT programs in an effort to really call the attention. So we're doing the best. I think that now with these new partnerships that we have with the districts, we can strengthen those relations. But again, it's also looking at the curriculum for the Board of Education that we cannot.
Let me give you an example. Last
Can
year,
also, yeah, I was gonna,
last
can
year
also,
I'm sorry. So last year we lost 2 students because they had to work over the summer.
Yeah.
I mean, they could not come because they really, excellent students who want to go into medical school. And we offer them, to come and spend the time with us. Because we have several programs, no? We have programs that start at the 7th grade. And these kids could come from the area up to the graduation, and they will come every Saturday. We have those summer programs they came for high school students.
That's the Lang.
We have program also for college students. No, we also have the LAM program. As you know, there are several programs among us guided to increase the representations of our kids from the community into medical school. And like I said, I meet with Superintendent Ramirez all the time. I tell Superintendent Ramirez, whatever you need, ask us, and we'll try to get it. If he tell us we want to have a faculty in my classroom, we will offer to him. We have offered also to train them on the simulation with the School of Nursing. Whatever you could ask him. I am on his back, and Mary Hernandez, with his assistant all the time, and said, what do you need from us? Let me know, and we'll go and get it. And this is again our agenda.
All right, keep after them. OC, are you finished? Can I call on Tanya? Tanya, go ahead.
Yes, hi. And first, thank you, Dr. Lantigua, for coming here today. It's always a pleasure to hear from you. I do have some comments first, and then I do have a question that I want to ask. My reaction, I have lots of reactions to everything that you pointed out. One, when you talk about the targeting high schools and things like that, I would say by the time they get to high school in terms of science, it's too late. They're already behind other kids. And I say that from experience, yes. Having gone to a predominantly Black school in Chicago where we didn't have any science labs, where the first time I saw a beaker or even saw a science lab was when I tested to get into an exam school similar to Stuyvesant School, but it was in Chicago. And I walked in as a 10-year-old and I almost passed out. I had never seen anything like that in my life. And so I think that the pipeline needs to start earlier. Needs to start in elementary school. Suburban white children are already doing scientific experiments in like kindergarten. And so, that's one thing. So I don't know what you all are doing in that regard, but if it's not happening, that's something that perhaps working with the school district as well to really
Yeah.
start that earlier, much earlier.
Yeah.
It's not that they're not interested or getting them interested. It's that they're not exposed.
Yeah.
And that's
I'll just mention briefly, Tanya, before you get to your question, on that end, what we do with the elementary school is that we have the Young Docs program where they go into the classrooms and do the whole skeletal system and really talk to them about anatomy and in a fun way. So these are some of the things that we're doing, but we're doing that as guests going in to science teachers and getting into those classrooms. We wish it was a more structured offering of those services, and that's where we need the collaboration with the school district, because we do manage right now. We have Young Docs working with 3 elementary schools, and they do this on a regular basis.
right. Yeah. So something that's more involved, more extensive, actually more formal will be great, because that's what the white kids are doing in their schools already. So,
You
we're
can
getting,
help us. You can help us. I mean, from your point of advantage that you have as a community leader, as a stakeholder, with the superintendent,
As a nurse.
leadership. Believe me, I mean, this is a wonderful opportunity. It's the best opportunity I have ever seen in 40 years at Columbia. To do this kind of-
yes, by far. But I'm just pointing out that, it's very important to expose these children at the earliest stage possible, because that's real talk. That's not, we're not criticizing the fact that you're all working with high schoolers or anything. Your programs it sounds wonderful. I'm just saying that it needs to be exposed, because by the time I was in, by the time high school, they're behind and they're deficient. And so that's why that's important.
At the time that they enter school, they're behind.
They're already behind, right? And we don't want that.
At the age of 5 years, they're already behind.
And we don't. But anyway, I do have some other comments. I haven't said anything yet, so I just want to get all this out because this is important. And I want to also comment on your cab driver program, where you're talking to. I have a few thoughts about that, because are we talking about the same cab drivers that discriminate against Black people? Are we talking about those cab drivers, or what cab drivers are we talking about?
We are talking about cab drivers from this neighborhood. We got
to talk, because we have to talk, because if you're actively engaging in discriminatory practices, how are you going to be an ambassador to talk to, have cultural competent conversations with people? It's a concern to me, is what I'm saying. And I think,
and this is an opportunity to begin to address those issues as well, Tanya, I would say. And definitely it will not be those drivers. And trust me, we do get those complaints, and several of us have experienced those complaints. So yeah.
Yes, we're going to be very selective, because believe me, besides the education, again, these taxi drivers are going to be compensated. I mean, we're going to pay them, but we're also going to compensate them for a time. I mean, that we're going to be sure. I mean, the first group is going to be 50. It's going to be a very small group of 5,000 that we have between Northern Manhattan, and that we're going to be very selective, because we want this to be successful. I mean, we select. I mean, again, like I say, it's a process of education with them. I mean, they have to compete, and then they're going to be evaluation. They're going to be evaluated.
Okay, I do want to get to all my, because I know Steve is trying to move things on, but I need to get my points in, because this is very important. I hear you about that. I just wanted, to be aware of there are so many others, there are Black women who do this work, who could be ambassadors and do this and get paid to do this work, and they don't get these opportunities. I'm just saying, I just think that it's very important to really think through a little bit about resources the community already has. I mean, I know people who do this work, and they're, and they, struggle for opportunities to do these things. And so it's just something to think about. Last point before I ask my question.
Tanya, just because I stop there, because I mean, you bring a good point. We do have now 2 community at the workers program. One in Harlem, that Dr. G. Williams and Cindy Henderson, they direct. It's mainly working with churches down there and really employ both. It's many African Americans, employ both men and women into that one. We have also one that's done by the hospital, by Andy Nieto, or community health workers. And this work mainly with the CBOs, community-based organization up here. Now, we just were awarded another big one for community health worker program. That one is going to be doing mainly cancer, is going to be doing really most of the work is going to be on cancer prevention, cancer education. Again, that's going to employ also at community health workers, Dr. Williams and Dr. Mary Beth directing this. This effort I just told you is because this one is coming right now because we had the money from Pfizer. And like I said, this one is going to be maybe small. I mean, it's a 5-year program to train around 250 to 300 community taxi drivers. And we'll see how it goes. If it's successful, then we can go and establish the program going forward. I mean, and like I said, it's going to be a process of evaluation. I mean, the classical thing, you pay somebody to get into the taxi to see what happens. I mean, we do that. I mean, they talk to you. They keep in the money doing nothing. Which way they talk to you? I mean, it's going to be a constant program evaluation. But we're going to have at the end of next year, I hope, 5 different community health worker programs.
Okay. And then the mental health program, I just wanted to put this in your ear in terms of making sure that, you know, I know we're working with CBOs and things like that, but not all CBOs are prepared to work with all populations. There's a lot of divisions in this community, you know, along ethnicities and race and things like that. And so I think it's very important that we are intentional in terms of who we get to do that work, because one of the things I've noticed is that it's hard to find people who are like myself, that you can, you know, that people can go to for mental health services. And so I just think but my question, so I can move this along, because I know Steve's getting irritated.
Mm-hmm.
My question is, what is the mission of your initiative? Because you're doing a lot. A lot of these things are fascinating and I want to hear more, but what is it what is your mission? What is your goal with all of these programs in terms of anti-racism initiative? Because, you know, my concern still remains with the doctors and the nurses themselves in terms of how they behave. I've been in the house in the ER where there was Evelines, like literally nurses that I had to like get your, you know, reps to deal with, who treated me so badly and treat Black people and Black women particularly so badly, and they're dying from childbirth and things like that for neglect. How are we, you know, I want to make sure that that kind of thing is also being addressed, even as you're doing all this outward facing work. The internal stuff is still very, very, very needed. I just want to know, what is your goal? What is it that you want to achieve? And how are all these programs going to help in that regard? How do they fit within this mission?
I mean, there are multiple, you know. I mean, increase diversity at all levels in the institution. I mean, and we feel that that's important. I mean, again, like you said, access to care to us is also important. Our community has access to care, and we said access to care, we talk about good care at our level, the same that we also give others that come from all around the world. We want to be sure that people who are around us get the same type of care. That's true. We have created an office of professionalism. Each of us are being trained, okay? I mean, on conscious and unconscious bias. I mean, each of us are getting through training. I mean, we hope, and it's mandatory training. We hope that we will be able to change the culture of the center. And we also are creating offices all over. Where, I mean, whistleblower, that you can tell us who is not behaving. I mean, and that person is going to be called. I mean, now there are places where people can come and complain about us, and we're going to take it seriously. I mean, this is no longer a joke, but like I said, I mean, again, what we see, the things that you want, we want to see more of us inside the medical center. When we talk more of us, and talk about the diverse community of Washington Heights, Inwood, and Harlem, more of us. We want to see the same thing that you said, that when you come to the medical center, you say, Jesus, I want to come back, because I was treated as a professional. I mean, the person who saw me really cared. about me, and I really want to come back, and we are looking for that. I mean, I didn't hear anybody joking about me. I didn't hear anybody making fun of me. I mean, because they are really professionals, and that is the ultimate goal. And I think it's coming from the leadership. I mean, it's coming from the people who are really now. The student, but the students are pushing us. The students are doing this. These are the leaders of the institution that are doing this. It's president of the hospital, the dean of the medical school, and the chairman of the main departments. And we are meeting with them. I tell you, I mean, it's a score now for each of us. I mean, we are being measured in our performance. And when we are serious, we're really serious. We just brought an African-American female to be the vice dean of education, I mean, at Monica, and she's working really hard. Same thing. I mean, we are changing our curriculum. We're changing our curriculum to be sure that we have a curriculum that's fair and really teach around the person that live around us. I mean, again, it's multiple goals. But at the end, the best is one is really diversity and really be sure that we provide the best care to our community.
All right, thank you. Sally.
Yes, congratulations on your medical school admissions. I think it's totally, 3 or 4 times the actual rate of other schools. I just had a comment about the mental health initiative. So that it's focused not on the worried well, but on people with serious mental illness. Just a suggestion that you work with Fountain House, because that's a population they treat. And I know Dr. Vasant is right across the street at the Mailman Public Health School. So I just, I would like to see that focus be not, on people with serious mental illness that are not finding care in the community.
This is so important. So important, Sarah, to each of you. I promise you, before we launch the program, I'm going to be in the principal prayers to speak with you. I'm going to be sure that, before the program go out there, those who are going to be in charge, they come and they present their visions to the community board and to the health community. Okay?
Yeah, anything I can do to help, I'd be more than happy to.
Thank you.
Very good. Catherine.
Yeah, just because I know we need to move on. Thanks again for the presentation. Are there plans, or maybe it's already in place, because it's such an expansive and broad initiative, to post this on Columbia's website where, folks can see the goals and, what successes you have all had, and makes it also easier for us as a board to follow it over time?
Yes, most of these have been placed in the GCA at the website. Most of these initiatives, they are there. Again, we try to keep in touch all the time because it's a changing environment. But every time that we have one of those, it's been posted that the community can know that this is going on. But like I said, those one that I mentioned this evening, I'm going to send it to Steve that he can share with you.
And I think maybe at future meetings, we'll focus on one program at a time, and instead of going across the board, because there's so much here to deal with, and Tanya and others had good questions that we don't really have a chance to pursue fully. And the woman you mentioned earlier, the African-American woman who's been hired. Her
name is Monica Lipson, Lipson.
Lipson.
Lipson. She is the Vice Dean for Education.
Vice Dean for Education?
Yes.
All right, well, maybe at some point we can have her also come before.
She would love to come. She will love to come. You just ask her. Because she's a very dynamic person, and she.
Good.
Yeah.
As long as you don't tell her how we treat you, then hopefully she'll agree to come before.
I've always been treated very nice by this group, always.
Well, they don't listen to me. That's why. Do we have any other questions? Oh, see, once again, you're getting off easy, Raphael. Okay, so thank you very much.
Thank
Please
you.
please give me a report in writing and work with Sandra on it. And because there was so much ground that you covered, I really want to have really want to have something in writing that I can circulate to the committee members.
In your case, that was my intention to confuse you that you cannot sleep this evening.
Well, you succeeded once again. Once again, whenever I see you, I can't sleep. Thank you so much.
Thank you.
Okay, very good.
Okay.
I think we lost Sandra. She's no longer with us. Julio. Julio?
She said to excuse her, she had to jump in another call. This is Sandra.
Sandra went to another call?
Yes.
What about Julio?
Steve, you hear me?
Oh, yes, I can hear you, yes.
Oh, okay, good, good. Sorry, I had to hop off and, and use my phone at this point.
Oh, okay. Can you, are you ready to give your report?
Yeah, so just like to, add something to the discussion. I know that, that it's very difficult to sort of get some of the young people to go into medicine, especially if they're already, in high school and, the grades are challenging. And so I just would like to add that, we do have the Land Youth Medical Scholars Program, which really, have kids start very young, at 6th grade, to get them involved into the healthcare field. So, I'd be happy to, to bring someone to the committee to talk more about their work and what they do to really get kids engaged from the 6th grade on to try to get them engaged into the healthcare field. So, and it's been very, very successful.
But are you successful in getting kids from this community to go into that program?
Those are kids from the community. These are not kids from the suburbs or somewhere else. These are all students who come from school district 6 in our community. So
and how many kids do you normally have each year?
So it ranges. I mean, from 13 to probably 17.
Okay.
And the good thing of that is that we have all these students basically graduate. We have a number of students who've come back and now working at a New York Presbyterian. So this is a very successful program, and it's should be mirrored in other places.
Okay.
I'm going to bring you the numbers. It's not Anna Sepin any longer. The only person who is a member of the faculty at Columbia that grew up in Washington Heights. This year we have made 3 medical residents to our programs. All of them grew up in Washington Heights, and each of them went to school in Washington Heights. They went to medical school, one to Columbia, the other 2 went to medical school elsewhere. But now they're ours. One is in medicine, 2 are in psych. One medicine, 1 psych, and 1 OBGYN. That way it is. Yeah.
All right, well, let's meet them one day. That's great.
Well,
what
I'm leaving because I talk too much. Let me tell you what's happening now. I think that we have an Asian faculty association. Now we have formed with Dr. Williams and others a mayor at the African American Association to stimulate more mayors to come in there. I mean, and to stay. And I'm working with Ana Cepin, Amara Minguez, to create the first Latino faculty association at Columbia. They're going to encompass faculty, residents, fellows, and students with the idea that we could attract more students to stay in medical school with us.
Let's go back 1 second. You can't go yet. The 3 medical residents who grew up in Washington Heights.
Yes.
One of them is now doing what? General medicine?
No, remember, we have Ana Cepin. No, you know Ana Cepin. Ana Cepin is an associate. Ana Cepin is an associate professor OBGYN. She grew up in Washington Heights, and she went to school in Washington Heights.
Okay, right now, I only want to know the specialties. One is this woman.
Right now we have these are residents. One is in internal medicine, one is in OBGYN, and the other one is in psychiatry.
Psychiatry. Okay, internal medicine, OBGYN, and psychiatry. All right,
Yes.
so you're gonna introduce them to us at some other meeting. Okay, very good. Okay,
At some point, when they have a little bit more skin, the skin is
okay, but now you're leaving, right? This time you're really leaving, right? Because you already talked us out. Okay, good
All right.
night. Thank you.
So let me continue on there. Yeah. So I just want to mention on, I know you mentioned at the start of the meeting that there's been an increased numbers of, I guess, of diagnosis up in our area. But happy to report though that in terms of the hospital, our numbers continue to go down. System-wide, we have 150 patients who are admitted. So the trend continues to be on the right track, and we're happy for that. The hospital continues to provide vaccination to the community and to our patients, both the first dose as well as the third dose of Pfizer. And we're doing that to those who are eligible to receive that. Vaccinations continue at the Winter Garden at the Morgan Stanley Children's Hospital for the first, second, and third dose of the booster shot of Pfizer, which is the one that's been approved. We continue to support the NIMIC bilingual hotline. And for all of those who don't know the number there is 646-838-0319. It is open and scheduling appointments for the community members. There are many slots still available. There's also, many other opportunities to get your vaccine, done at other locations like, Walgreens, CVS, Walgreens, Rite Aid. I've actually checked Rite Aid on 170th Street. They have plenty of appointments. So, there's a lot of opportunities throughout our community to be able to, get your vaccine. The vaccines are available. But we continue to do that at the Winter Garden as well as our clinicians. In terms of getting people to get vaccinated, as Dr. Lantigua said, and Sandra, we've are doing, presentations around vaccine education. We, as I mentioned in the past, this committee, we are available to bring in any of our clinicians to speak in any language that you feel necessary to make presentations. Doesn't matter how large a group or how small, presentations are available, and we'll be happy to be able to coordinate something if you need that. Just like to add a couple other things is that, you're all very familiar with our CHALK program. They've been incredibly helpful to our CBOs during the last 18 months since the closure. They've been providing webinars on how to strengthen your board, how to strengthen the organization. They're continuing their webinar series, and they have a series coming up on October 20th. It's really to provide information to CBOs on data collection. So I will make that available to Steve so he could help circulate that. I know that the community board has been helpful, and they have, I believe, done a couple of email blasts, announcing the webinar. The 34th annual Medical Center and Neighborhood Fund is taking place on October 27th. Excuse me. Happy to report on that. Over the last 2 years, faculty and employees have been incredible. We've collected, they've donated much more than years past. We will be distributing a little over $100,000 to community groups this year, and we'll make sure to that you all get the invitation to join us. It will be on Zoom, unfortunately, still, and hopefully next year we'll go back to our regular routine and have this at the faculty club as we have in the past. And then finally, I just want to mention that the holidays are coming up. Thanksgiving is around the corner. There are many families in our community that are struggling, and so we're again going to do the Thanksgiving food drive. We will be collecting food, making baskets, full meals for 4 to 6 people. They'll be put in bags and distributed to El Nido La Esperanza, which is 174th Street and Broadway, and they will provide these meal baskets to members of the community. So looking forward to that. We hope to serve a couple of hundred families, and we're doing the same with the Allen Hospital. And there we do with an organization called Coalición Mexicana, which is located in the Bronx. And again, there'll be a couple of hundred, baskets, that we'll distribute to families there as well. So that's my report.
Okay, well, Julio, you know what my question is? If there are 150 patients system-wide, how many patients with COVID are here at 160 and at the Allen?
I will have to get you the numbers, Steve. I don't have those. Speaking of, I know I gave it to you. I gave you the numbers last time for what it was.
Right.
I'll get you the numbers for for Columbia and Allen.
All right, you got to come to these meetings with those numbers, or else you're letting me down.
Okay, I got you.
All right, next question is to Sally.
Yeah, quick comment on the discussion about introducing younger students to your programs. The problem is a lot of our elementary schools don't have science programs. So that's something that maybe Faye and her committee can work on.
I'm sorry, Sarah, they don't have what? I'm sorry?
They don't have science programs. They cut back on science and sort of anything we need in elementary school and focusing just on, reading and math. So that's an issue in terms of trying to approach students early. And then for my standard monthly question, any update on Allen Psych?
So let me just mention and I understand the STEM, the science part for these young students. The good thing with the Lang 6th grade is that they come into the hospital.
We're losing.
And doctors. So that I'm saying that, our Lang program brings the kids into the hospital and not just going to their classroom. So that exposes them a little bit more. The Allen Hospital, the psychiatric unit, nothing new to report on that. It is still, there's no change. So no change to that.
Okay, thanks.
Sure, sir.
But Julio, I have to say, if the level of COVID patients keeps going down, and you no longer need those beds at the Allen to serve COVID patients, at some point they got to be converted back to their intended purpose as psych beds. So, this doesn't make sense.
Well, I understand your point, Steve, but I guess if you looked at this a month ago, 2 months ago, you had to be ready in case the numbers would not go down. And I'm happy that they're going down, and I hope that will continue to be the trend. But I will take your comments back to folks at the Allen.
I mean, at some point, a decision has to be made. If we keep on talking as you've referred and others have referred to at this meeting, that things will go back to normal next year, that you're going to have the Medical Center Neighborhood Fund ceremony in next year, that you're already forecasting and assuming that normal patterns can return next year. Well, if that's the case, then so should the psych unit. The psych unit will also return next year, and that's how we should be talking. We should be. We shouldn't just be saying we have no idea what's happening with the psych unit.
So Steve, I would take your message back to the folks at the Allen.
Okay.
I wholeheartedly understand what you're mentioning.
Okay, I don't expect, and I don't even think Sally expects you to say that starting next month you're gonna convert the beds back into the psych unit. But I do expect that you're gonna live up to the Article 28 certificate or whatever it is, and you're gonna say that at some point when things return to normal, the psych unit will also come back. All right, Catherine Diaz, to you.
Yeah. Hey, Julio. So I guess for the next month or for future months, just to kind of put on the radar, if you can report to us on the flu initiatives at the hospital. And
Sure.
it'd be really great to hear, you know, in terms of cases, as we know, like last year was really low numbers, given mask wearing. So it'd be, you know, it'd be great to kind of hear if that's the same forecast, and what shifts.
Sure, and I'm happy to also mention, and thank you for reminding me that, you know, every year we do partner with the community board, who helps publicize it, along with our elected officials, you know, annual flu shot events, free flu shot events for our community. And, you know,
Hello, Julio, we lost you.
sorry, I think I lost you. So
Yes.
later this month, we will continue. We will be doing some of these. We're going to be doing one in the Bronx, at St. Gabriel's Church. We're doing one at Hebrew Tabernacle later this month, and also looking at doing something in Inwood, somewhere perhaps around like Puerta Estrecha, which is on like between 204, 207th Street. And we'll do a couple of as well in Harlem. But, you know.
Very good. I got my flu shot today. Yeah. Catherine, are you covered now?
Yes, thanks, Steve.
Thank you. Jay Mazer.
Julio, it seems a hospital is a business, same like any other business, and in terms of the psych unit, isn't it true that the return on investment per square foot of space, if it was doing hip replacement, then using it for a psych facility? And isn't that a consideration in terms of returning or not returning the facility for use as a psych unit?
You know, to say that, you know, the decision to
Actually, I'm asking, not saying.
no, listen, I couldn't tell you. The fact is that the decision that was made to, you know, to relocate the psychiatric unit at the Allen, you know, was not based on saying, well, it makes more sense for us to make more money. Let's do this instead of that. That's not what this was all about. So, you know, I couldn't speak to your question about, you know, what's more profitable, because that's not what this is all about.
Well, right now, the beds are not bringing in any revenue at all. If you don't have COVID-19 patients in those beds, then they're empty. They're not bringing in any money.
Yeah. Well, but again, I mean, in terms of Jay's question, in terms of, you know, what's more profitable, whether you do hip or you treat patients with mental health, it's I couldn't speak to that, but that's not the decision around the you know, that was done, I guess, in 2018 about relocating the unit.
All right. Well, I hope you're right. All right. Does that cover it then? All right. Very good. Thank you, Julio.
Thank you, Steve.
All right. Did Nye Whitaker ever arrive? I don't think so. Okay, Betty, do you have a report about Isabella?
We continue to function in an organized and healthy manner. We've been very successful with the extensive vaccination efforts, and we're not experiencing any interruption in patient care or operation. More than 99% of our staff have received at least their first COVID vaccination, and 100% of our employees that come to Isabella each day must have received at least their first vaccination. That's required, as you may know. 89% of our residents have been vaccinated, and as you probably know, we cannot require it. We speak to the resident and to their families and suggest it, but it's up to the family and the resident, frankly, as to whether or not they receive their vaccination. Let's see, any visitors, we encourage them to have been vaccinated as well. We before they visit a loved one, they need to go through a test in the Larson Library and in the recreation hall to make sure they're not COVID positive. We've been able to control the incidence of COVID very well at this point. So we're encouraged by that. Another note, we received notice that one of our NORC programs, Naturally Occurring Retirement Communities, the one that supports the numbers 11, 17, Fort George Hill, and 45 Fairview, those 3 high-rise buildings, that we did receive approval for an extension of our NORC programs for another 5 years, which is very good for the 400 and plus residents of those buildings that are over the age of 65. And actually got some more money, so we're able to add some more staff. And that's very good news. And Julio, I think, is still on the call. I want to thank you on behalf of the of WICOA, of which Isabella is a member, for the notice that we received for the receipt that we got from the neighborhood fund for this year. I just wanted to extend a very public thank you to you. We certainly can use it in the Washington Heights and Inwood Council on Aging. Thank you, Julio. Okay.
Thank you, Betty.
So Betty, in those 3 buildings alone,
Right.
the 3 Mitchell Lama buildings, over 400 residents are at least 65 years old. So, wow. Yeah, and these are
The 3 NORC programs that we have over 1,000. So we have one at Riverview Terrace, and we have another one in the area of Presbyterian called El Cortizone. That's the smallest of them. But this was an RFP that we had to respond to in the summer, and we did receive notice recently that we've been approved. So that's good news.
the one around the one around the medical center, is that based in the New York Presbyterian owned buildings? Where is that based?
It's 165th Street to 168th Street, and it's building by building. That's how it's been identified. It's called a neighborhood north because it has to do with who resides in what building. That neighborhood is changing demographically, so the number of people that are over the age of 65 in that particular area is actually declining.
Wow. So, but
Yeah.
it's between 165 and 168.
Then 165 to 170th. It's a very odd geography.
Okay.
Identification building by building.
In various buildings. Okay, and the other one is in River Terrace at down where I live. Okay, but and in all 3 you have over 1,000 senior citizens. Is that what you said? Yeah. Okay. All right. Very good. Any questions? Seeing none, we now move on to the discussion and vote about our FY23 expense and capital budget priorities. I sent out a revised list to the committee members. I don't know, maybe it was last night. So I can run through them again one by one. The first one was to expand mental health services in the community, especially for seniors and others whose mental health and social engagement have been adversely impacted by COVID-19. The next one is to increase services to prevent and treat chronic diseases such as Alzheimer's, diabetes, cancer, heart disease, and hypertension, conditions that increase susceptibility to COVID-19 in our community. The third one was to increase trash basket collection on commercial streets in District 12, fully restoring the FY21 budget cuts. I believe those budget cuts have been restored. But I think what we also heard from Ebenezer last month was that the district superintendent would like us to continue to advocate for this and to urge that additional funding be provided so they can have a second shift. The fourth item was to increase staff to conduct regular noise enforcement, especially nighttime, air quality monitoring and water quality testing. The fifth one, to increase funding for a targeted educational outreach campaign for COVID-19. And what we discussed last month was changing that item to talk about urging the city to open a full-time vaccination site. The next item was to increase HIV/AIDS prevention and treatment services. The seventh was to increase substance abuse services in our community, including opioid overdose prevention education and funding for syringe cleanups and collections. Next one was to increase pest control efforts to eliminate rats, cockroaches. The ninth was to provide funding to ensure that all local public schools have multi-service health clinics with nurses and social workers. The 10th was to increase funding for education and outreach on recycling, reuse, and composting, as well as proper disposal of household garbage in our community. And the 11th item was to create an educational campaign about the federal public charge rule to inform immigrants of their rights to obtain health services and other benefits. And we discussed, since that public charge rule that had been proposed by the Trump administration has since been rescinded, we discussed dropping this one from our list since it's no longer relevant. So we're left now with 10 items. Is there any discussion about changing the order of the items? OC, I know you must have, oh, Sally, thank you. Sally, what's your comment?
I guess it's both for the capital and the expense. I think that we need to focus a little bit more on funding for things related to climate change, put more emphasis on those items. So for example, under capital, we say that we want green infrastructure, but I think it's critical now. And I know today, City Council, or yesterday, they passed a bill that would require there to be a plan for every neighborhood, and we are an environmental justice area. So I think that Inwood is. I think that we need to sort of fine tune some of these. Unfortunately, I don't have the words for it, but fine tune some of these to really focus on environmental risk.
Okay, well, I want to do the capital next.
Okay.
Let's focus on the expense side. I mean, I would like to think that this question about opening up a vaccination site will be resolved in the very near future. But this list does get transmitted down to OMB and get circulated to the city agencies, I guess, in November. So right now that item is number 5 on our list. I would like to bump it up maybe to number 2. Sally, is that a new hand?
No, sorry.
All right, OC.
Mine is related to the capital expense, so I'll wait.
You can wait. Okay, Catherine.
Well, my hand's not up for that point specifically. It was just if we're going to discuss adding any like new items for expense. So kind of like and this is where my line of thought is that I know that we were talking about capital in terms of the environmental justice and climate change or mitigation, but I'm thinking, for example, Jocarina presented last time, and it feels like, of course, we always learn with things when there is an emergency, but thinking, if we do want to increase funding for well, it's not an office anymore, but I guess it's a department or whatever, for community initiatives, that's an opportunity to bring those things into the expense side over capital and kind of like increase our number of points dedicated to environment. But I wasn't necessarily raising my hand for about moving number 5 up or lower. So
all right. Well, do I have perhaps a consensus that we can move the vaccination site up to number 2? I see Betty is giving me a finger. A thumb. Very good. Two thumbs. All right, I'm going to take that as being a consensus. So we're going to move that up to number 2. And
Steve, sorry, I was gonna say, if we bump that up to number 2, I would suggest not bumping trash basket collection to, what would that be, 5, but keeping it at 3. And then the increasing of treatment of chronic conditions as like number 4, just so that within our top 5, our top 3, 4, we still have environmental issues addressed.
all right. This is like doing the batting order for a baseball team. This is great. All right. So the vaccination site is number 2. Trash basket collection remains as number 3. Increasing services for chronic diseases is number 4. And then the increased staff to conduct regular noise enforcement would be number 5. HIV/AIDS is 6. Substance abuse is 7. Substance abuse is pretty damn important. Pest control is 8. Health clinics is 9. I'd like to move that one up too. And funding for recycling, reuse, and composting is at number 10. Sally, has had a new hand?
Yes. I just have a comment on trash basket collection. As I think you're aware, because I sent you an email, the city council's biggest initiative in terms of post-budget allocation is from NYC cleanup, which is $280,000, which goes to every community to fund cleanup, cleaning services, graffiti removal, etc. A lot of council members allocated a substantial portion of that to the Department of Sanitation for extra pickups. Our council member only allocated $40,000. So I think in addition to impressing upon the city that we need more trash pickups, we need to impress on the council member that we need him to take the environmental initiative seriously and actually allocate them to groups that are doing cleanup. I would suggest that maybe at our next meeting, we have someone from his office report on what he's done and the results he's achieved with his environmental funding.
I second Sally.
I'm really not sure that we're going to accomplish much with that. I would suggest that we maybe focus on the new council member when she takes office in January. She'll then have an opportunity to decide on these allocations, in the upcoming budget.
But it's 4 months away.
Yeah,
Well,
yes.
there's still time, Steve, for him to reallocate to groups that are actually doing environmental work or to the Department of Sanitation. He can just pass a budget, a transparency resolution and reallocate those funds to groups that are actually doing work that's environmental work.
Yeah, I agree with you, but I don't see him doing it.
And there's no guarantee the new person will either.
That's also true.
Just saying.
That's also true.
Even having him report on what he has and hasn't done would be educational for the community.
All right. Well, we can try. Okay. But those. All right. So you're saying that in some cases, council members have allocated money for additional trash pickups. That did
to Department of Sanitation.
Right.
Yes.
That did not occur in our district. So this is still a legitimate thing for us to advocate for.
Yes.
Okay. All right. All right. Are there any other suggested changes?
I know later on in the agenda, you mentioned something about the textile recycling. And I don't know if we want to advocate for the resumption of services. I know a lot of buildings have tried to get composting and they get a response back from the city that there's not enough people that are interested, but maybe we could do something with composting and also textile recycling.
Sally, we have it as, I know it's kind of like all loaded into the education and outreach point on recycling. That's where the composting is, because yeah, there's very few bins up here for that.
It's already down here on, it's number 10 on our list. Do you want to move it up on the list?
I would prefer moving it up from an environmental standpoint, and also not just education, but implementation of those programs.
Right. What do you?
I mean, we can educate all day long, but if it doesn't happen, you know, education only goes so far. We need to have funding for the actual programs.
So where would you want to move it?
Number 3.
No, we're not doing that.
Nope. I do not want the noise enforcement to be moved down any further. If that continues, we will be in the hospital. Okay. Because that has health impacts and mental health impacts. Okay. So, you know, I just, you know, I'm listening to the Indy 500 right outside my window right now. So I'm just saying.
Well, I can see moving the recycling up to maybe number 8, putting it ahead of the pest control efforts.
Not as far up as I'd like it, but I'll take anything.
Excuse me?
I said not as far up as I would like it, but I guess I'll take anything at this point.
All right. All right. All right. So that'll be number 8. Pest control goes to 9. And then one of my favorites about having health clinics in every school is now down to number 10. Okay. Do we have a motion to accept the revised list of expense budget priorities?
I move to accept the revised list of, what is that, the expense budget?
Is there a second?
I second it.
Is that Betty Lehman? Can I get a show of hands as to how many, you know something, no, we'll do both at the same time. We don't need to vote twice. Okay, so now on the capital budget, our number 1 item was to expedite the replacement of old water mains and sewer lines. The second one was to provide additional garbage collection trucks and street sweepers. And the third was to install green infrastructure such as bioswales to divert stormwater from the sewer system in our community. And then our 4th item, which we listed as just continued support based on the assumption that this is a project that's in the pipeline, is to construct a new District 8 garage and relocate its trucks from our garage on 215th Street. I found out last night that this project to create a new District 8 garage is apparently not going anywhere. So I would now suggest that we rank it as one of our items and not just have it for continued support, because that no longer seems appropriate. And actually my suggestion is that we make it our number 1 priority, because it's long overdue that these garbage trucks be moved out of our district. And in the Inwood rezoning, by the way, the plan was to free up this area as a potential site for affordable housing. Osi, you have a comment?
Yeah, I agree with you, but what the other thing that I'm not sure if we can put it on the you know, capital budget is the you know, looking for a site maybe, or try to attract a hospital to build a trauma center.
No, I don't think that's a capital item. You know, I think that's something that they can that they should house within their existing emergency room. And you know, we're going to pursue this issue. And we don't want the city to build that. The city already has a trauma center at Harlem Hospital. I think what we want is a trauma center at Presbyterian. So that would not entail city funding. And Presbyterian just a few years ago spent something like $100 million to expand that emergency room at 168th Street. So, you know, they should be able to handle the trauma patients. far as I'm concerned, and I guess as far as you're concerned too. This is not a capital budget issue. Next, Catherine.
State issue, not a
Yeah.
city.
So it might be controversial, but since we can only have 3, if we're gonna add in the garage point, I mean, I was gonna say to have number 3 as number 1. I don't know personally enough about our old lines and like what's the status in terms of repair, progress, or impact. So I would have recommended to eliminate our existing number 1, have green infrastructure as number 1, and then we can bump up the garage. I mean, we're already talking about increased collection, so I do feel like we have to keep having additional trucks. But again, I don't know what last year's response was in terms of new trucks, like in terms of a need for more trucks.
Well, I think what they said basically is that they would handle it within their existing resources.
So should we eliminate number 2?
Well, first of all, we're not limited in only having 3 items. So if that's your understanding, we can we have 10 items under expense. There's no quota system. We can have as many items as we want. I mean, 3 is a nice number, but so is 4, and or however many we want. But this was additional trucks was number 12. Hold on a moment. Yeah, their response to us last year on the additional garbage trucks was to say that they'll accommodate this issue within existing resources.
Okay, well, I mean, I don't know. I guess I would say if that's something that they feel that based on the way that our winters are going and climate change, then great. If not, I mean, or we could just have 4. I mean, I know that as a board, we rank considerably less than what, and we're able then, like we're not able to submit as many as we'd like at the end of the day, but I do think it's good to give the rest of the board options of 1 through 4.
No, Catherine, you're wrong. Even though there's supposed to be a limit on the number of expense and capital budget items that we can submit, I think it's 25 on the expense side and 40 capital items. We always exceed that number, and to my surprise, we send down the entire list, and the entire list gets circulated through OMB. They don't eliminate anything. I'm shocked.
Oh, okay.
They don't seem to. They don't make us comply with that rule, so I wouldn't worry about it. But so your suggestion now is that we make the green infrastructure item number 1 on the list instead of the District 8 garage.
Yes, and thanks for the clarification.
All right, so
And maybe refine that to say to address the risk of climate change, instead of just to address sewage overflow or whatever it currently says.
I'm sorry, to address what?
To address risk of climate change.
Well, I mean, I think that's a given, but okay. All right, so what's the consensus of the group as to what you would like to see as number 1?
I'll go with Catherine on green infrastructure.
All right, OC?
Me too.
Green infrastructure. Betty Lehman doesn't want the garage, so she'll go with the green infrastructure. She has a vested interest. Tanya?
Yeah, that's fine with me.
Green infrastructure. That's what you're saying is fine with you?
Yes, it's fine.
Okay. All right, Jay?
Yeah, green infrastructure is okay.
Okay, that's good. Wendy?
Can you hear me?
Yes.
Green infrastructure.
Green infrastructure. All right, I've been overruled. So that's green infrastructure is number 1. All right, can I get my garage as number 2?
Yes.
Yes, please.
Okay, very good. Expediting the replacement of old water mains and sewer lines would then be number 3. And the additional garbage trucks would be number 4. I'm assuming that's the case. All right, so we have a resolution that I hope that OC and Betty Lehman will agree to amend, which calls for adopting the revised list of both expense and capital budget priorities. Has it been so amended by OC and Betty?
Yes.
Yes, it has been. Very good. I can't see everybody's hands. So OC, how do you vote? Yes?
Yes.
Who's next? Sally?
Yes.
Tanya?
Yes.
Jay?
Yes.
Catherine?
Yes.
Wendy?
Yes.
And I vote yes. 1, 2, 3, 4, 5, 6, 7 yeses.
And I vote yes.
Oh,
And I vote
I left out Betty. 1, 2, 3, 4, 8 yeses. Okay, and Mary, we extend to you the privilege of voting at our committee meeting. How do you vote?
Yes.
Very good. Okay, all right. We're finished with that item. That went pretty smoothly. Very good. Old business. I have circulated the latest report from DEP on the service requests for the month of September. 251 service requests or complaints from Community District 12. Hydrants running was that was somebody complaining about hydrants. 45 hydrants were running, and then another 33 complaints that they were running full. Not just running, but running full. So that's 78 of those combined. And then the third biggest item on the list is people requesting lead kits, probably to test their water. 16 such requests. On the street sidewalk cleanliness ratings for the month of August. Our streets were found to be 95.8% acceptably clean, an increase over July, which was at 89.6, and a year ago we were at 92.2. Our sidewalks were found to be 100% acceptably clean, an increase over the previous month in July, 96.9. A year ago we were at 98.1. I've also circulated to the committee members the latest report from the Department of Design and Construction about the gas main and water main installation work taking place in Washington Heights, primarily east of Broadway in the 180s. The report says that they are now at 79% completion, and they expect, I guess, to complete everything by December 27th. On the issue of textile recycling, I have been in touch with the Green Market folks who host the recycling at the Green Market at Isham Street. They have agreed to add that site to their list of places where they intend to start resuming textile recycling. They are looking to determine where exactly they can place the tent. I'm in discussion with them to agree upon a location. It will maybe end up in just on the periphery of the Green Market, inside Isham Park, not on the street itself. But I think we'll come to an agreement shortly. And they can't give me a date right now, but it is in the first tier of the Green Markets where textile recycling will be resuming in the near future. OC, is that your hand?
Yes, it is. Why are they reinventing the wheel? They've been in the market before, so it's only a question of coming back to the market.
Yes, they ceased the operations at all the Green Markets with COVID. They've opened up 5 sites, and they're slowly opening up more.
Right, and they want to do it in a socially distanced way. They don't want all of them on top of each other. So, the vendor that they use, they don't do it themselves. I forget who they bring in to do it. They're not apparently equipped to start up all of the sites all at once. So they're easing into it.
I understand it, but my question is, they're already been in that particular green market, a farmer's market. So the space is there. Why are they trying to reinvent this wheel? I mean,
Well, they're telling me that they're reconfiguring the layout. I haven't been there myself, but they're telling me that they're spreading out the tents and being more socially distanced than they were in the past. So they can't put it exactly where it was before. But I think we're going to find a suitable location for them.
they can be right next to the composting or the other side of the composting.
Well, we looked at that, and the Parks Department people didn't feel as though there was enough room there. But we're going to find them a space. That's not going to be an issue.
Okay, I hope to see them soon.
Okay, well, I am pushing them on it because you're pushing me and I'm pushing them. Sally.
Yeah, I don't know if this is old business or new business, but I commented in the general board meeting that no one seems to address what's going on with COVID in schools. I don't know if you can impress upon Faye that should be a topic there, or whether it's under our purview to address COVID risks in our schools.
And how would you want us to address it?
To hear from community members about the issues in our schools, the lack of HEPA filters, the fact that it's not being enforced uniformly in terms of masking and social distancing, the fact that there's huge risk. I mean, the risk is less now, obviously, with the requirement that teachers are vaccinated, but there seems to be a fair amount of discussion on social media in terms of people worried about sending their kids to schools because of the risk of COVID, especially younger students that aren't yet eligible for the vaccination. And I just find it remarkable that the community board has not weighed in on this.
Yeah, do you know whether the Youth and Education Committee has been discussing that issue?
As far as I can gather from Faye's reports, no.
All right, well, let's maybe offline talk some more about how we can approach it.
Great.
Catherine.
No, I mean, I was gonna say, because I do some work with the DOE, and so it's pretty complex. I would say first bet is to see not just Faye, because we only hear from Faye, but maybe if it is on their agenda for this year, and that's an opportunity for us to explore it as as perhaps a kind of like a real special joint meeting. I do think also, like, it's important to actually hear from students themselves and from teachers and principals and perhaps District 6 staff who can better explain the conditions in each school. There's a lot of robust things in place. And, personally, I do know that many of the schools have some really strict measures, and there's a lot of work being done through parents associations. So, I don't think it's been like a one size fits all. So I do think it'd be a great opportunity to actually hear from individual schools in the community themselves on, what their experiences has been, especially, if it's in December or January, whatever, like 3-4 months into the school year in.
Yes, I mean, you're right. Maybe we could do this as a joint meeting.
Yeah, that's what I had suggested at the community board general meeting, is that we do sort of a joint town hall on COVID in schools.
All right. Well, let me talk to Faye. Okay. All right. That's it for old business. Is there new business?
Oh, Steve, I had one old business question.
Oh, back to old business. Tanya.
Sorry about that. Yeah. Did you ever hear back from the DOH about whether they were willing to present to us about the mental health impacts of COVID? Remember that they were going to, then they didn't want it being recorded.
Oh, you know something?
I was just curious, whether they had changed their minds about that or were holding fast.
I may have dropped the ball on that one, because I think after we had that abortive meeting, they called me up. I had suggested to them that they just do their own meeting that
Right.
it wouldn't be a community board meeting. We would maybe help advertise it, but they could just do their own meeting so that they could set down their rules. But I didn't call them back. So are you suggesting that we should still do this, right? We should still have that meeting?
Oh yeah, I think people losing, there's a lot of people, I'll put it this way, there are a lot of people having mental health challenges as a result of COVID. So I think it's an important, discussion to have in terms of how that has impacted our community, everyone as a result because of the pandemic.
Okay, good. Okay, point well taken. I will call them back.
Okay, thank you.
Pauline, are you still with us? All right. Okay.
She was still logged in. I see her still logged in.
I'll find the guy's name and number. I'll contact him. Okay, very good. All right. All right. A new business. Any new business? Sally.
Yeah, I just wanted to mention an event that was held on the 1st at the Hudson Restaurant. A group called Flavor Fusion Fest did a Guinness World Record-breaking event where they made the largest serving of mongoose at 1,000 pounds. And we actually worked with them to make sure that things were recycled, were composted, etc. So it was a great event, but it's a world record now held by Flavor Fusion Fest in the Hudson.
Well, I was amazed because I went there the next day for dinner. I assumed there would be plenty of mango left over, and there was none to be seen.
Well, we actually arranged to donate the meals to Uptown Community Fridge Network with Washington Heights Inward Food Council. So if you got there that day, you could have had some mongoose, but after about 7:30, it wasn't longer available.
So they all went to the neighborhood fridges?
Yes.
Wow.
They packaged and labeled 400 meals, and then they handed out another 100 meals at the event. And then served people who were at the event.
400 meals were donated, and they could all fit within those fridges?
Yep.
Okay. All right, fantastic. Okay, OC.
Okay, so is the trauma center can be something we can revive, or it's not really a new business then, but I don't know if you want to look at that as new business.
Well, my idea is to
start engaging in a conversation, an ongoing conversation.
my idea is to reach out to the people at EMS and to ask them how their operations are affected by not being able to bring trauma patients to the medical center, and to raise this issue with the state health department when there is a new commissioner there, which will be very soon.
Okay, because
she starts on December 1st, and it is a state decision.
Yes.
I understand that, but I just want to, it's kind of mind-boggling to me that people in getting shot in our community and being sent to St. Barnabas in the Bronx.
OC, I think we all agree with you. I think you've raised a very good question that's been out there for a number of years that we have not focused on, and I'm glad you're making us focus on it, and I think there's going to be an opportunity for us to pursue it very soon. So I'm
okay. I just want to put it out there that at least in one occasion, one of them went to the Allen Hospital. I mean, and I think he died, but regardless, it's just that I understand what you're saying, Steve, but I don't know if everyone on the committee understand the severity of the situation.
Well, I think we should pull together. Let's do some research and pull together as many incidents as we can find where patients were taken all the way down to Harlem or to St. Barnabas, where we thought they should more logically just go to 168th Street. I don't think the Allen Pavilion is really, I assume it's not really set up to be a trauma center. I think logically, it probably would be located at 168th Street.
Steve, if I could just add also, I think it would, this is actually also another opportunity to collaborate with public safety. Because you're right, we have a brilliant new state commissioner coming in. And because conversations of equity are more mainstream, I think it's a great opportunity to also talk about public safety and how, you know, not having a trauma center is also a matter of public safety. So, you know, I think, I'm not to say like this is something that has to happen now, but I think for us to kind of like brainstorm and think through what that could look like.
Steve?
Yeah, I don't know what's on this. There's some strange stuff on my screen.
But my hand's been off.
Oh, that's
for a while.
Sally, you're sharing your screen, I think, because it says Sally Fisher
Yeah,
screen.
it's Sally.
Oh, Sally, can you take that stuff off the screen? Jay, go ahead.
The only question I have about your suggestion about 168th Street is the emergency room already has the longest wait time of any emergency room in the country, which leads me to wonder whether it actually could be set up to deal with acute trauma.
Well, that may be that may be an answer that the hospital gives, but I don't know. I got to believe Harlem Hospital also has a busy ER, but
not as busy as Presbyterians.
I don't know.
Or it might be as busy, but the patients don't wait as long to be served.
Well, I mean, this may be one thing I find out when I talk to the people at EMS, but I understand your point. All right. Okay, OC, is that a new hand?
No, I'm sorry.
Very good. Okay, are there any announcements? No announcements. Very good. Can we call this meeting to a close at 9:25?
Motion to adjourn?
Who's that? OC?
Yes.
And Betty Lehman is now your regular seconder. So motion to adjourn at 9:25. Okay, it's been unanimously accepted. Catherine, was this meeting okay?
Yes, Steve, for the number of items, great job keeping us on time.
Okay, very good. All right, thank you all. See you soon. Take care.
Good night, everyone.
Take care.
Okay, Betty, please send me your. Oh gosh, no more recording.